Good evening, friends. Let us start with the first episode today of Materia Medica, understanding Materia Medica, and how to tackle the diseases that come our way through the physicals. Because there are so many people and so many schools talking about the mind, the emotional aspect of all the remedies, and everybody tries to improvise, everybody tries to interpret what the mental symptoms are given by Hahnemann and all the other stalwarts in their own way, and then there is always a chance of misinterpretation, there is always a chance of misunderstanding, and many youngsters usually lose their way or are kind of enticed by the glamour which is being shown by the various schools of homeopathy, which are uh, flocking everywhere nowadays. It's like really blooming every day because it appears so glamorous, but when you are in the practice, when you are in your clinic, it becomes so difficult that it is very difficult sometimes to find out the exact mental state of the person, right? So what is more important is physicals, as our stalwarts, as our teachers have always told us, that they are very, very important, they are very, very solid, they have a solid base. Nobody can misinterpret them, nobody can interpret them wrongly. Whatever it is, it is. When you have got craving for salt, it is craving for salt. When you have got a right sided headache, it is a right sided headache. When you are thirstless, you are thirstless. There is no emotional attachment to that, there are no strings attached, and therefore physicals have always been the bedrock, they have always been the solid foundation of any prescription, understanding the patient. So therefore we are going to start this series. This is my first remedy that I'm going to do, and we'll be doing remedies regularly. And I want you to think about a remedy solidly, understand the remedy solid through its physical generals and physical particulars, because any prescription which is based on physical generals and physical particulars is always very, very strong, rather than on some interpreted mental symptom, rather than any interpreted symptom by any school of thought which are blooming and which are flocking everywhere, which are making homeopathy glamorous, though glamorous, but they are at the same time dangerous for newcomers, because newcomers, though they get enticed and they get attracted to such mental emotional symptoms, but at the same time they are not able to understand that each mental symptom could have many, many remedies. But with the physical strong evidence of a case, physical generals, physical particulars, you can really find out the remedy faster, and you are very, very sure. As Hahnemann said, rapid, gentle, and permanent. Okay. So let's start today's remedy. I am Dr. Samir Chaukkar. I am the Dean of Dr. Batra's Academy. I've been in practice for last around 32 years, teaching, practicing homeopathy in India and abroad, specializing in autism, ADHD, and learning and behavioral disorders of children. And teaching has been my passion since a long, long time. I was ex-professor at YMT Homeopathic Medical College and a guest lecturer at various colleges in India and abroad, presenting my research papers, presenting papers in national and international conferences, and love to teach. And really, whenever I travel abroad, whenever I see students, running after mental, emotional symptoms here and there, trying to evolve here and there, it really pains me, because authors like Boric, authors like Nash, authors like Allens, these are the authors who have really shed their blood and perspiration, and they have shed their energy looking at all these things, collecting the symptoms, proving the symptoms, whereas we are just looking at some mental points here and there, misinterpreting them. I am again saying misinterpreting them. If you interpret them rightly, you might reach to the similum, yes, but most of us interpret it wrongly and reach to the wrong remedy and get disappointed and then leave the system itself. That's why we see so many homeopaths are going into insurance and hospitals and not practicing the classical ethical homeopathy and the rational homeopathy that Dr. Hahnemann had taught us. So let's talk of the first remedy. And whenever we talk of homeopathy, the first remedy that comes to my mind is Aconitum Napellus. So, what are the things that come to your mind when you think of aconite? Now, let us look at what Dr. Boric talks about Aconitum Napellus. The common name of Aconitum Napellus is monkshood, and it's an acute remedy, as they say. It is an acute remedy, but what experience, what medicine have taught us is that there is nothing like an acute and a chronic remedy. We have heard aconite even being prescribed in a tumor, aconite even being prescribed as small as the cold and coryza also. So, aconite, there is a state of fear, anxiety, anguish of mind and body, physical and mental restlessness. Right in the medical college, in homeopathic college, when I was there, when we would talk of aconite, we used to compare it with arsenic and we used to compare it with rust ox, where teachers used to tell us, and now I know that it's really true, that when you talk of rust ox, it is physical restlessness. When you talk of arsenic, is mental restlessness. And aconite is a combination of physical and mental restlessness. Fright is the most characteristic manifestation of aconite. And the onset, remember, the only thing that can delineate aconite from many other remedies like bryonia, gelsemium, causticum is acute, sudden, violent onset. So don't forget, my friends, acute, sudden, violent. He got exposed to cold draft of air just now. He was traveling in the bus, caught a bus in the morning, and by maybe caught a bus at 7 o'clock, and by 9 o'clock he started running nose. By 9 o'clock he started a headache. By 9 o'clock he started all his complaints, which means everything comes acute, sudden, violent invasion like a storm. Remember. And just like a storm comes and takes over and completely wipes off the economy, Aconite also does that. But what is most important is with the acuteness is also the fear of death. Aconite, they say that it relates everything to fear. Even I can talk about patient where he came with a nasal discharge and he says, doctor, my nose is running so much. What if all the water from my body gets empty and I die? I mean, that is strange. Nobody dies of a cold and coryza. But this acute invasion of the economy, along with fear, will call for aconite. Remember. So don't forget acute, sudden, violent invasion. Sudden and great sinking of the vital force. Remember that. Complaints and tension which is caused by exposure to dry, cold wind. So ailments from dry, cold wind is very, very important. Dry, cold weather is very, very important. Drought of cold air. Checked perspiration. Many a times we have a habit that when we are out in the sun, we come back home and stand under the fan or put on the AC, and or maybe go and shower under the cold water. This will check the perspiration. Remember, check perspiration. Also, complaints from very hot weather, especially gastrointestinal disturbances. It is the first remedy of inflammation. Serous membranes and muscular tissues affected markedly. Now, if you see serous membrane, you are also thinking of bryonia. But understand, bryonia and aconite. Aconite is something which comes suddenly. Bryonia is something comes very, very gradually. Serous membranes are affected. The pleura is affected. The peritoneum is affected. The joint spaces are affected. But still, aconite is fast. Belladonna, bryonia is slow. Sorry. There's tension. Always remember, there was a book I remember, Dr. Dubey, which we used to read in our first year, and he had written tension is the keynote of aconite, and I really did not know what that tension is all about. But now I understand the tension is as if something is going to happen. Everything is so tense in the body just after the acute invasion. Remember, so tension of the arteries, emotional, physical, mental tension. So when prescribing aconite, remember, aconite causes only functional disturbances. Remember, there is no structural evidence at all, there is no structural problem at all, and therefore there is no periodicity. It is a good remedy for influenza. So you have to remember these points: physical and mental restlessness, sudden violent invasion with fever, exposure to dry cold weather, draught of cold air, checked perspiration, lot of tingling, coldness and numbness, tension. Okay, and most important is functional disturbances. Okay. So this is all about aconite. Remember, in Allen's keynote. Let's go to another book. Another very important book is Allen's keynote. Remember, we have seen Boric. Now we look at Allen's keynote. Here he talks of acute or recent cases occurring in young person. Remember, Allen's keynote always starts with kind of constitution. It's a very, very nice book, and it is a compilation of Herring's guiding symptoms. Remember, therefore, it's a very, very condensed and kind of a compact view of Herring's guiding symptoms. So he starts with the constitution where he says it is used for acute cases, recent cases. So somebody coming to you with a problem of 10 years, 15 years, 20 years, you will never think of aconite. But somebody who has been exposed to cold air yesterday or today morning and has come up with some symptom, you can think of aconite. Especially girls of a full plethoric habit who lead a sedentary life, people who are affected by atmospheric changes. We saw exposure to cold air, cold draft of air, dark hair and eyes, rigid muscular fibers, something similar to Bryonia. Remember, because Bryonia is also dark hair and eyes, rigid muscular fiber. But see the difference. Aconite is acute. Bryonia is more chronic, more slow. It is a subacute, though it is not chronic. It is a subacute. Complaints caused by exposure to dry cold air, dry north or west winds, exposure to drought of cold air. Again, a repetition I'm telling you, because these are the important points. While in perspiration, checked perspiration, great fear and anxiety of mind, that is always there. So fear and anxiety is a constant concomitant in Aconite. Whatever he suffers from, he has fear and anxiety of mind. Without fear, you cannot give Aconite. Remember, Hahnemann himself says, whenever Aconite is chosen homeopathically, you must above all observe the moral symptoms. So though this lecture is all about the physicals, here I want to reiterate and here I want to concentrate more on the moral symptoms, because that's what Hahnemann says. Be careful that it closely resembles the anguish of mind and the body, the restlessness, the disquiet, not to be allayed. So Hahnemann himself says that whatever the complaint may be, if there is fear along with this complaint, fear, fright, fear of death is there, think of aconite. You can think of arsenic also, but remember arsenic is more deep acting. Arsenic will have more structural pathology. Aconite is not structural. Aconite is more functional. Okay. So this is very, very important. Burning thirst for large quantities of cold water. Again, differentiate with arsenic. Differentiate arsenic was sips of water, and that also not cold water but warm water. Here there is a burning thirst for large quantities of cold water. Fever, the skin is dry and hot, no perspiration at all. Aconite, aconite. Remember, aconite in fever there is no perspiration. If along with the fever you have perspiration, aconite will be disregarded. Remember that. So fever, the skin is dry and hot, the face is red or pale and red alternately, with burning thirst, and of course the nervous restlessness tossing about in agony. Another very, very important remedy for cough, croupy cough. Remember, one of the trios of croup, aconite, hepar and spongia. Remember, three remedies for croup: cough, croup, dry horse, suffocating loud. From again dry cold winds. So ailments from dry cold winds or drafts of air is very, very important. Ailments from fear is very, very important. Aconite should never be given simply to control the fever, never alternated with other drugs. If it is a case requiring aconite, no other drug is required. So nicely given by Allen, remember. Okay. So this is what Allen says. Let's take the last book, which is one of my most favorite, and that is Nash. Nash says it starts with fear of death, crowds, going out, anything always fearful, complaints from exposure to cold, dry, cold, congestion and inflammation. First stage, remember, it's a first stage remedy. With great anxiety, heat, and restlessness, tossing about in agony. Pains are aggravated at night, face is red, flushed. Larynx is attacked, the bronchi are attacked, the lungs and pleura, the joints, as we talked of serous membranes. Aggravated in the evening, lying on the left side in warm room or warm covering, better by uncovering. Now he talks of the restless remedies, aconite, arsenic, and restox. So it is something simple that we did in our first BHMS. Remember, aconite, arsenic, and restox. All are equally restless, yet all are so very different that there is no difficulty in choosing between them. The aconite restlessness is often found in high grade inflammatory or cyanocal fears. There is no better picture in few words of aconite fever than given by Herring. Heat with thirst. Heat with thirst. Remember, we talked of burning thirst for large quantities of cold water. Hard and full, frequent pulse, anxious, impatience, inappeasable, besides himself, tossing about in agony. The custom of alternating aconite and belladonna in inflammatory affection is so widely prevails. It is a senseless one. That's what Dr. Nash says. Both remedies cannot be given at one single time because they are totally different. Both have great heat of skin. Yes, we understand. But aconite is a dry, hot skin. No sweat. Remember, I told you no sweat. Completely. When you touch the skin, it is dry and hot, no sweat at all. While belladonna will be more hotter. It will have more heat, but he sweats on cover parts. That's how you'll differentiate between aconite and belladonna in fever. Remember. Again, I'm repeating. Dry, hot skin, no sweat. While here the heat is more in belladonna, redness is more. You will touch and you will immediately remove your hand, but on the covered parts they'll be sweating. Aconite tosses about in agony with great fear of death. Now remember, belladonna does not have fear of death. He's more into semi-stupor and jerks and twitches in sleep. Aconite has distress in the heart and chest. Belladonna seems to be center on the head. Remember, aconite fears death. Belladonna fears imaginary things like dogs and dark. Something will come out of the dark. Remember, it belongs to the family Solanaceae. Remember, so a lot of fear, fright, No man who understands the homeopathic art of healing will ever alternate these two remedies. This is what Dr. Nash says, and such a golden sentence. Remember that. But still, people do give, when somebody comes with fever, you give aconite and you say, okay, first take aconite, then you take belladonna, or take it alternately. No, 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 no. Aconite and belladonna are totally different remedies. It's a great pain remedy. If we were to name three leading remedies, aconite, chamomilla, and coffee, three pain remedies. Therefore, aconite comes into a lot of trios, remember. When we are thinking of aconite, belladonna, also aconite, chamomilla, coffea, the aconite pain is always attended with extreme restlessness, anxiety, and fearfulness. Cannot bear the pain. Okay? The aconite pains are intolerable and are always associated with numbness, just like platina, remember. So, aconite and platina are two remedies where pain is with numbness. In it, it resembles Restox also, but with aconite, the pains predominate, while with Restox, numbness predominates. Remember. So, if you're talking about pain and numbness, pain is more in aconite, numbness is more in Restox. Therefore, Restox is a very, very important remedy for sciatica and neuralgias. Remember. Okay. So, again, he's talking of fever here, and he's written very nicely that even in the old school astonished at the results of homeopathic treatment so superior to their so-called anti-phlogistic treatment and finding aconite so highly recommended and frequently used in inflammatory affections concluded in accordance with their usual way of reasoning that aconite could be squeezed into their pathological livery and made to do service in all kinds of fever simply because it was fever. But they soon found out, however useful it might be in some cases of inflammatory fever, it was of no use in typhoid. Remember, you can never think of aconite in typhoid. Yes, you can go to Bryonia, you can come to Pyrogen, you can think of Restox, but never aconite. Remember, so never ever give aconite in typhoid because it does not have the depth of going into. Dunham writes, aconite is never to be given first to subdue the fever and then some other remedy to meet the case, never to be alternated with other drugs for their purpose, as often is alleged, of controlling the fever. There has to be the typical anxiety, typical fear, typical pain, typical ailments from. All these things go together like, beads in a single thread, and all of them will make a, necklace. That's very, very important. Without these beads, without all these beads, the necklace won't be complete and the cure won't be complete. So that's it about aconite today. We have tried to read it from very important books, and I have tried to compare a lot of other remedies also with aconite. Next time we'll talk of another remedy. Just to put back here, the aim of these sessions is to bring back the importance of physical symptoms, how strong they are, and how we can base our prescriptions based on physical symptoms rather than getting misinterpreted, misunderstood through mental symptoms, though they are glamorous. Though most of the people in the seminars talk about mental symptoms, but nobody talks about the strong physical generals and physical particulars. So, my friends, let's start these sessions. Let's talk about this. I want you to like the session, subscribe the sessions, and ask me questions about it. And I'll really love to answer your questions. And bye from here, and we'll meet again now. Okay, bye bye. Take care of yourself.